A very good evening to all of you. Welcome to my YouTube channel. So today's topic is sexually transmitted disease from your medical surgical nursing part. So our first content is mode of transmission. STD are spread through the contact of a penis and vagina. When you have a multiple partner, in that case, in men through the penis and in women through the vagina, the sexually transmitted disease can transmitted. And the next point is the rectum. Some people are doing anal sex through the anal canal. May this STD can transmitted one person to another person. Breaks in skin. When you are suffering from any type of skin disease or are having wound, in that case, you this disease can transmitted. And the mucous membrane and needle sharing. Through the mucous membrane and needle sharing, this disease can affect your body. Most probably, the healthcare care professional affected with this disease. And our next point is the blood contact. Through the blood transfusion, STD can transmitted through one person to another person. So our next point is mother to child transmission. If a mother is affected with STD during delivery, the baby can affected with the sexually transmitted disease. And the main thing is uh, the sexually transmitted diseases are HIV, AIDS, and second point is syphilis, and the third point is gonorrhea. So the definition of a sexually transmitted disease is infectious disease most commonly transmitted through sexual contact. When you are having multiple partner and sex with the multiple partners, in that case you are suffering from sexually transmitted disease. Can also transmitted by through the blood and blood products and what through the any type of skin disease. In that case, this disease can transmitted by. So, the areas of infection, eyes and mouth, skin, joints, genitalia organ and pelvic organs, rectal area, nails and feet. So, risk factor of STD is IV drug use. When you are having IV drug, in that case, this disease can contain. And other substance abuse, high risk sexual activities, younger age at beginning of sexual activity. ଯଦି ୟଙ୍ଗର ଏଜ୍ ମାନେ ବହୁତ କମ୍ ବୟସରୁ ଆପଣ ସେକ୍ସୁଆଲ୍ ଆକ୍ଟିଭିଟିରେ ମାନେ କରୁଥିବେ, ଦେନ୍ ଇନ୍ ଦ୍ୟାଟ୍ କେସ୍ ୟୁ ଆର୍ ସଫରିଂ ଫ୍ରମ୍ ଦିସ୍ ଡିଜିଜ୍। ଇନର୍ ସିଟି ରେସିଡେଣ୍ଟସ୍, ଯଦି ଆପଣଙ୍କର ସିଟିଜ୍ରେ ଏଇ ଡିଜିଜ୍ଟା ଥିବ, ଦେନ୍ it can cause. Our next point is poverty and lower socio-economic status. So in this point, poverty, ଯେତେବେଳେ ଗୋଟେ ଗରିବ ଘରର ଗୋଟେ ମାନେ ଗୋଟେ ମଣିଷ ଯେତେବେଳେ ତାକୁ ପଇସା ନଥାଏ, ସିଏ ପ୍ରାୟ ଟାଇମ୍ ସେକ୍ସୁଆଲି ମାନେ ଖରାପ ଜିନିଷରେ ଲିପ୍ତ ରୁହେ। ତ ଇନ୍ ଦ୍ୟାଟ୍ କେସ୍ ଦିସ୍ ଡିଜିଜ୍ କ୍ୟାନ୍ ଆଫେକ୍ଟ ପୁଅର୍ ନ୍ୟୁଟ୍ରିସନ୍। ଯଦି ଗୋଟେ ପେସେଣ୍ଟର ଗୋଟେ ଲୋକର ପୁଅର ନ୍ୟୁଟ୍ରିସନାଲ୍ ଷ୍ଟାଟସ୍ ଥାଏ, ଫ୍ୟାମିଲିର ସେମିତି କିଛି ସୋସିଓ ଇକୋନୋମିକ୍ ଷ୍ଟାଟସ୍ ଏତେ ଭଲ ନଥାଏ, ଇନ୍ ଦ୍ୟାଟ୍ କେସ୍ ଦ ଡିଜିଜ୍ କ୍ୟାନ୍ ଟ୍ରାନ୍ସମିଟ୍। ପୁଅର୍ ହାଇଜିନ୍, ଯେମିତିକି ଆମର ମେନ୍ସୁରେସନ୍ ବେଳେ ଆମ ଝିଅମାନଙ୍କୁ କୁହା ହୁଏ କି ଠିକ୍ସେ ମେନ୍ସୁରାଲ୍ ହାଇଜିନ୍ କରିବା ପାଇଁ, ତ ସେଇଟା ଗୋଟେ ମେନ୍ କାରଣ ହେଉଛି STDର। So the pathogen of STD is pathogen with bacteria. The diseases are chlamydia, gonorrhea, bacterial vaginosis, syphilis. These are the bacteria. The pathogenesis of virus, herpes, hepatitis B, genitalia warts, HIV/AIDS. HIV/AIDS pathogen of the parasite is pubic lysis, scabies. That's it. Common symptom of STD is when you are having STD, how you know you are suffering from this disease. So pain during urination, ଯେତେବେଳେ ତମେ ଆପଣ ମାନେ ବାଥରୁମ୍ ଯାଉଥିବେ, ସେତେବେଳେ ଆପଣଙ୍କର ୟୁରିନେସନ୍ କଲାବେଳେ ବହୁତ ପେନ୍ ହେବ। बम्प और स्कोर्स मतलब जोटा आमर जो फोटका टाइप गोटे गोटे भी हुए स्किन से भी गोटे सिम्पटम STD रो। ब्लीडिंग बिटवीन पीरियड, ମାନେ ପିରିୟଡ଼ ଭିତରେ ବି ହେଭି ବ୍ଲିଡ଼ିଂ ହେବ, ସେଇଟା ବି ଗୋଟେ କଜ୍। ଅନୟୁଜୁଆଲ୍ ଡିସଚାର୍ଜ ମାନେ ଆପଣ ଯେଉଁଟା ହ୍ୱାଇଟ୍ ଡିସଚାର୍ଜ ହୁଏ ସେଇଟା ବି ଆପଣଙ୍କର STDରେ ମାନେ ଏକ୍ସେସ୍ ହେବ। ତାପରେ ପେନ୍ ଡ୍ୟୁରିଂ ଇଣ୍ଟରକୋର୍ସ ହ୍ୱେନ୍ ୟୁ ଆର୍ ହାଭିଂ ସେକ୍ସ in that case you are facing with some heavy pain during sexual intercourse. So rashes in skin, you are suffering with rashes. Many people can have no symptoms, asymptomatic and still pass on a STD. So କିଛି ଲୋକ ବି ଥାଆନ୍ତି ଯେଉଁମାନଙ୍କର STD ଥାଏ ବଡ଼ିରେ, କିନ୍ତୁ ସେଇଟା ଆମର ସିମ୍ପଟମ୍ କିଛି ଦେଖାଏନି, ଯେଉଁଥିପାଇଁ କି ମାନେ ପେସେଣ୍ଟ ମାନେ ଜାଣିପାରନ୍ତିନି କି ଆମର STD ହେଇଛି ବୋଲି, ଯେଉଁଟାକି କୁହାଯାଏ ଆମର ଆସିମ୍ପଟୋମେଟିକ୍। So bacterial infection caused by bacteria, ଆଉ this agent represent about half of this site identification. Bacterial infection are curable and medication does not protect against the future exposure. Chlamydia and gonorrhea.